Hi everyone, Caitlin Clarizia here, and for my final project, I interviewed a licensed clinical social worker. Her name is Leslie McHugh. She has a private practice in Linfield, Massachusetts. That's where I'm from, so it was easy to go over there and interview her. In her practice, she focuses primarily on reproductive issues like infertility and prenatal loss. She also focuses on maternal mental health, like postpartum depression and anxiety. She also does adult, adolescents, and family therapy. I asked her specific questions regarding depression and anxiety in women who just had a baby. And my first question I asked her was, how did she enter this field of work? It is a pretty broad field and she does a lot of different topics. So I was interested to see what her background was like. So first off, she got a bachelor's degree in counseling psychology from Lesley College in 1999. That was a year after I was born. Then she got her master's degree at Boston College grad school in social work in 2003. So after that, she became a licensed clinical social worker in 2007, and then she became an expert witness since June 2008. Additionally, after that, she did a couple more trainings and other things to kind of tone her and hone her skills and figure out exactly what she wants to do. So she did the Karen Klein's postgrad advanced clinical training on postpartum to specifically work on postpartum. She also worked on some infertility training, and she went to a 3-day conference, which I found was really interesting. And it says, she talked about, it's called When It Takes More Than Two to Make a Baby, which I thought was pretty interesting. She also has some different activities and memberships. She's a member of the Postpartum Support International, which is really great. And then she's also a member of the National Association of Social Work, the American Society for Reproductive Medicine, and a member of Resolve. So that's pretty cool. So my next question was, what do you do on a typical day? And she is a very busy woman. She does a lot of different things. She handles a whole wide, broad range of different topics. So she does one-on-one counseling. This counseling can be for adolescents or children or adults. And she also does family therapy. She does group therapy, couples counseling that work on postpartum and prenatal issues such as infertility and pregnancy, and even sometimes infant loss, which is very difficult. She does some group therapy, and one of the most popular group therapy that she offers is a postpartum adjustment group therapy, where you meet with a small group of other moms and a clinician such as herself to help find support for depression, anxiety, anything like that. She also talks to different professionals such as doctors, clinicians, and nurses, and birthing professionals to give them advice on different ways to handle postpartum depression or prenatal loss or things like that. She goes to presentations and workshops and gives those to the general public, to mom groups, childbirth education classes, medical staff, and different members of the birthing community. She also does, like I said, some specific one-on-one therapy, and this can be for depression, anxiety, both bipolar disorder, adolescent counseling, family counseling, parental support, work and career grief counseling, and stress management. She really does it all, and it's a lot of different information that she can hand out there. So getting right into the maternal side of the interview, I asked her what is postpartum depression? I wanted to hear exactly what she thought it was and exactly her clinical standpoint and view on it. So she explained how a lot of people, after they give birth, they ask, why me? Why are these feelings happening to me? Why am I feeling this way? But she reassured that it's not their fault. They have a mix of hormonal issues. They include a big difference in biological changes, psychological influences, and different relationship factors. You now have a small child you need to care for, and it's really stressful for some women and can bring upon a lot of depression and anxiety and a lot of different problems. So these hormones, you are flooded with hormones when you're having a child inside of you, and when that's over, all those hormones just go away, so you can experience severe depression and severe problems such as being sad or irritable or weepy or just overall moody. I also wanted to see what were typical signs of postpartum depression for expecting mothers, and if they were different for someone who was not expecting. So she explained that Some of the signs and symptoms would be reoccurrent or regular crying spells, crying for long periods of time, just not feeling like yourself, not being able to help yourself feel better. Frequent irritability, feeling irritable all the time. No one really likes to feel like that, especially if you just had a small child. It's really difficult. Reoccurring angry outbursts, not wanting to be with your baby is a really big one. Fears of harming yourself and even fears of harming your baby. That is very scary and really, really sad. Feelings of being inadequate as a mother, that is a really big one. That is different for people who are expecting than people who are not expecting. Severe fatigue, loss of interest in pleasurable activities, feelings of overwhelm, hopelessness or despair, loss of appetite, dramatic weight gain or dramatic weight loss, excessive worrying. And those are all different signs that many people experiencing depression feel like, not just expecting mothers, but also they may feel obsessing about babies despite the reassurances from their family members. They might be so scared that they're hungry, or that they just keep changing their diaper, or they just aren't feeling comfortable with themselves or with the baby or what they need or how they're feeling. They might also have nightmares or flashbacks regarding this traumatic childbirth or other previous traumas that may be brought upon because of this really difficult feelings that they're having. The next question I asked her was, how does depression negatively impact the lives of these expecting mothers? And this statistic was very surprising for me. She said that 80% of women get what she calls the baby blues. This is just feeling intermittent feelings of sadness and happiness, just kind of mixing around, not knowing what's going on. Your hormones are all messed up inside, and 80% of women experience this. However, if this lasts for 2 to 4 weeks 2 to 4 months after giving birth, that is a sign of there's another problem. And 15% of women experience this, and this is when it becomes postpartum depression or anxiety. This is when there becomes an issue and you need to talk to somebody. A telltale sign are thoughts of suicide, like I said, or harming your baby, which is incredibly sad. So she explained that not getting help for something like this would be having a broken arm or a broken leg and just putting Band-Aids over it. And it's the same thing, even though this pain is not physical, as we've talked about throughout our entire chapter, these people are still struggling. People with OCD, people with depression, anxiety, schizophrenia, all of these different topics that we've talked about and spoken about throughout the chapters, you can't just hide them. You can't just keep putting Band-Aids and saying, I'm okay. You need to speak to someone. You need to reach out, get medications. And on that note, I also asked her how she helps expecting mothers with postpartum anxiety and depression. And she had this great acronym, and I thought it was ironic. It is STRESS. So with the acronym STRESS, it gives people different ways to cope with this anxiety. So the S was for self-care. She suggested eating well-balanced and nutritious foods. Getting enough sleep is really, really important, and not substituting alcohol and drugs for your feelings. That is a really big one. And this can lead to substance abuse, and something that we've learned about in our chapters. It's a very big issue, and especially if you're expecting mother, you cannot mix in alcohol or drugs, because that will go right into your child and it'll cause even more problems. The T in stress was talking it out, talking about your fears, worries, or stress, maybe with a trusted friend or with herself, a clinical psychologist, or even a spiritual leader. She suggested that, and I thought that's something that's really interesting as well. The R is relaxation, meditating. She suggested journaling, soothing music, candles, baths, and massages. I could use one of those right now. It's a really important way to just kind of de-stress, help with that anxiety, kind of get some time for just you, and that can really help your mental state. Exercising. This is a really big one. I'm an exercise science major. I really, really, truly believe that exercising is a great way to get out some of these pent-up feelings and emotions. The next one is S, is self-awareness. Help gain perspective on the situation. Kind of try and step back and view it in a larger context. Help you bring back to the present and understand what's going on. This can be really difficult, but with the help from family and friends and therapists, it's really good to mix in that match. And lastly, she talks about the serotic method. This is 6 questions that you can ask yourself and to try and change your negative thought pattern. It's 5 questions. So it is, what is the evidence that my thought is true? What is making all of these thoughts true in my head? Next is, what is the evidence that my thought is not true? Tell me why the way I'm thinking is not the way that I should be thinking. Thirdly, what is an alternative explanation for this viewpoint? How can I change my thinking? Next is, what is the best thing that could happen? What is the best thing that could happen from these feelings and from the way that I'm thinking and everything that's going on? Lastly, what is the most likely outcome? What is going to happen from all of these things? A lot of times people just add all this stress and worry onto themselves, and they don't even need to. They're kind of making it up in their own heads. But sometimes these questions are a really great way to go about figuring out how to do it. My next question was, how do you treat expecting depression in expecting mothers? So she talks about combining support, education, and counseling. Those three ways to kind of mix it all in. And my next question tied in with this as well. I asked if she would use depression medication and if that would harm the fetus. She talked about how she would rather try therapy techniques instead of medications to avoid any complications that may happen with pregnancy, since everything that the mother ingests goes into the baby. So it is important to try and do it with a behavioral cognitive approach instead of using drugs. But if it gets to a point where they need it, a lot of times they are not harmful to the child and to the fetus, so they can be used if it's an extreme circumstance. My last two questions were, what is the most difficult part of your job, and what is the best part of your job? The last one was my favorite question. But first I need to talk about the most difficult parts. I think this would be a very, very difficult job, and I think she has a very broad range of difficult topics that she has to deal with every single time. She talked about the most difficult would be when you are providing support for somebody and trying to help with them, and you grow a connection and a bond with these people, and you may not be able to provide the proper support that these clients need, and something happens to them. It may be loss of a life, or it may be something very serious, but it's a very, very difficult aspect of this job. Also, just the topics she talked about are very difficult. Prenatal loss is very, very hard. Also, postpartum is very difficult depression to have, especially because you have suicidal thoughts from yourself and also thoughts about killing your child. That is very difficult, and she talked about how that's a very impactful part of her job. And lastly, I asked what the best parts of her job was, and this really opened my eyes to see how exciting this job can be and how meaningful it really can be. She talked about having a successful breakthrough to a client, just having them have this aha moment where they can finally see the good and they can see the things that are going on in their life, going on the right track and helping them with their issues. And she feels accomplished, and she feels like she's really helping these people figure out what they need to do. Also, just managing a crisis. Once if they come in with a big crisis and they're all frazzled and they don't know what to do, and she can just calm them down and talk them back into a rational headspace, she says that's really, really, really rewarding. And also, a great thing is when a family is struggling with infertility so long, she is just overjoyed when the family is able to conceive, and that's just a really important big part of her job that she really, really loves. So yes, like I said, I was interviewing Leslie, and she was amazing, and I'm really happy for this opportunity. I really enjoyed this abnormal psychology class. It was difficult, but I really learned a lot, and I think I'll be able to use all this information in my career as an occupational therapist, just to see how other people act and other people react to all different situations. So thank you so much.